Limb lengthening surgery, how we do it. So friends, the limb lengthening surgery is a surgery in which we can increase your height, or we can increase the height of one particular limb if there is a limb length discrepancy due to an infection or trauma or your congenital condition. There are particularly two types of limb lengthening surgeries. In one type, we use external fixators. It can be a monorail system, or it can be a Alizarov external fixator. In second surgery, we use a magnetic rods, intramedullary magnetic rods, which grows automatically in a push of one button, which is a device which is given after the surgery, and you have to take that device on your thigh and push a button, and because it has a rare earth magnets, it grows inside gradually. So friends, in the first surgery, we generally use monorail fixator over intramedullary rod, but this intramedullary rod is a simple rod in which there is no magnet. We generally prefer to use a femur bone for this. Why? Because in the thigh bone or the femur bone, we can achieve at least 3 inches of height increase. If we are using an external fixator, we put an intramedullary rod to maintain the alignment of the rod. If you don't put an intramedullary rod with the external fixator, there might be chances that when we increase the height, there can be some kind of bowing of your leg. So the length is increased over an intramedullary rod by an external fixator. In the monorail system, we put 3 pins on your proximal femur, 3 pins on your distal femur. We make an osteotomy cut in your bone. Everything is through a keyhole. There is no big incision is given. And after a few days of the surgery, we start distracting your external fixator so that it increases in height. And the final outcome is at least 3 inches. But it takes a lot of time and effort. So regular physiotherapy is very important. In the second surgery, which is intramedullary expandable nails, magnetic. So we use either a precise 2 or a stride nail. We make a very small incision over your proximal thigh, and we insert the nail through the help of C-arm or image intensifier. We make an osteotomy cut through a very small incision, and after a few days of surgery, we can start distracting the rod with the help of external devices, and we will teach you how to use that device. Only with the push of button, the magnets in the rod start functioning, and it increases in the size by 1 millimeter every day. It is very important that after this surgery, you do regular physiotherapy. But the only disadvantage of the intramedullary expanded nails is it's expensive. Otherwise, if you can able to bear the expenses of the surgery, which is very costly, this surgery is beautifully done. There will be no scars. Nobody can tell you that you have undergone an surgery for the limb lengthening. There is no external fixator, and there is a very less chance or almost negligible chances of the infection. If you come to us for a limb lengthening, then we are going to decide whether we can offer you or not, because there are many factors which determines this question. If you are not psychologically fit, if you don't have an adequate family support, then we might reject you for the surgery. We do a thorough psychological evaluation of the patient who comes for the surgery. We check its background of the family, whether the family is supportive or not, because after the surgery, you have to be in regular physiotherapy. You can't go to work for at least 3 to 6 months till your bone is growing. So very good family supports, emotional stability is required for the best outcome. And you have to stay with us for at least 3 months after the surgery till the lengthening is achieved, and after that you have to visit us every month, once in a month, for about 1 year. After the surgery, in both of the procedures, we have to remove the implant. We have to remove the external fixator, and we have to remove the magnetic rods which are inside your thigh. This is done in external fixator after 6 months, and in intramedullary nail maybe after 1 or 2 years, when you achieve a very good union of the bone. So if you think that you want to increase your height and you have a good family support and good financial background to sustain this surgery and the surgical treatment for 6 months without doing any kind of work, then only you can consider these kind of surgeries, and we will be happy to help you. So send us your queries, send us the information, and we will evaluate you and let you know what will be the best surgery for you, whether an external fixator or the intramedullary magnetic rods. The only disadvantage of intramedullary magnetic rods is the cost factor, which is very expensive. In our other videos, I have explained in detail about the cost of these two procedures. We care about